Good morning, and thank you thank you Dominique and Ian, and also thank you to Joe and Mitch for inviting me to speak at this conference. I see a lot of familiar faces out there, so either I'm getting really old or it's just nice to see those friendly faces. I'm going to talk to you a little bit about a journey that I've been on for the last 3 years and how that's crossed over with some pretty extraordinary people. And the title of my talk is Fighting for Their Lives, Literally, and it's the case of the rare disease patient. If you've worked in this space, you know that these are very unique individuals and individuals who are extraordinary in many measures. So I would like to take you through this by just going through a particular patient's case and sharing with you their story. And it starts with this quote from Margaret Mead, and that, "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, is the only thing that ever has." And this is very true when it comes to patients with rare disease. Unlike more common diseases where there can be literally thousands or millions of patients, there literally is a handful of patients that have to speak out and make a difference to save their lives. Too often in our society, what's happened is that these patients have fallen between the cracks, that they have led a very difficult and miserable, shortened lives because of their disease. And it really is important that we focus on helping not just the large groups in our society that have a large voice, but those that might not be able to help themselves. And that's where patients with rare disease come in. The first question I'm going to ask you is just a little background on what rare disease is, and if you know the definition of what an ultra-rare disease is. Is it A, less than 20, B, less than 100, or C, or number 3, sorry, less than 1,000 patients per million? If you could answer that. Great, so 47% was the correct, number 1 was the correct answer, so half of the audience knew that, and I'd just like to say that I've selected all the music for my questions, so thank you for that. And this brings us to marketing lesson, what I think is a very important marketing lesson number 1, and that a strong patient voice can make all of the difference. And when you think about that, patients really do put a name and face to a disease. It's not some long, complicated word, it's now a name and a face. Patients can also rally stakeholders to support their cause. They come together and work towards common goals and can be very persuasive. Politicians, bureaucrats, and insurance companies are all accountable to patients. And when patients never stop, when they never take no for an answer, patients can change their destiny. And for those with rare disease, strength comes from telling their story. In the age of social media, mainstream media, being heard can be one of the most powerful things that you can offer to make a difference. So I'd like you to introduce you to Lucas and his dad, Rick. Lucas was first introduced to me probably about 2.5 years ago. He was diagnosed with a disease that our product actually helps. He actually was diagnosed with this disease at the age of 18, and his life literally stopped. If you think about a teenager who doesn't really have a care in the world and is looking for an exciting future and what to do, this disease basically stopped him in his tracks. It had taken its toll over the years, and Lucas had been waiting for 18 months now for provincial approval of the drug that would save his life. In November of 2010, and you see the pictures here, Lucas was admitted to hospital. He had multi-organ failure. His kidneys were shutting down. His father, by his bedside, was looking with a grim reality of if his son was going to survive another day, another week. It was actually his father who then reached out, as any father would, and looked to media to help tell the story. And some of you may have seen this story. This goes back to November of 2010, December 2010. And he reached out pleading with somebody to help. And Tanya Talega, who is a Toronto Star reporter, picked up this story and started to tell Lucas's story. Meet Barry Katzoff. Barry Katzoff was the president of the P&H Association in Canada. Barry was lucky enough to live in Quebec and to be able to get access to the drug through the Quebec government that has a special program. So Barry, as a result of this, Barry was a CEO of a Fortune 500 company and actually had to retire simply because of his disease. He went on this drug and he wanted to give something back, and he formed the P&H Association of Canada. Barry met with physicians, bureaucrats, politicians, anybody who would listen to see if he could make the case for patients with rare disease. Barry coordinated efforts of the P&H patients from across Canada, brought them together, taught the patients what they could do to make a difference. They started to write and meet with their local politicians, met with ministers of health, key bureaucrats, even the premier of their various provinces. They reached out to friends and family to lend a voice, to make a difference for these few patients. At one point, Rick went to Queen's Park and pleaded the case with the leader of the opposition. He pleaded his case with the Minister of Health in Ontario. Here is a picture of another patient who was by Rick's side along with Barry. And these are people, when you see the faces, these are people who are just normal people, and they've been faced with a very challenging and difficult circumstance. And they stepped up, and they are doing everything they can to make a difference, not just for themselves, but for other patients suffering from the disease. Lucas was transferred to a tertiary care center in London, thanks to the efforts of the physician in London who made Herculean efforts really to get access to the drug, get his hospital to pay for the first dose. Lucas, after one dose, went from literally on death's doorstep to walking around the hallway in the hospital. The following weekend, Lucas was actually helping a friend install a hardwood floor. He was transformed in a very short period of time. This brought huge attention to the issue, the challenge that is faced in terms of drug access, and it even had the Premier of Ontario weighing in, saying that these issues have to be addressed and this must be fixed. So Ontario, and this leads me to question number 2, has a specific compassionate use policy. And in order for somebody to get access to this policy for a critical drug, a patient must be admitted to hospital in a life, limb, or organ-threatening situation and prescribed the drug in the hospital once they're discharged. So if you're able to survive, you may be able to get access to this drug. So my question is having heard that, do you actually believe it? Is that true, or is that false? Wow, I'm surprised. 50-50, it is actually true, which is maybe a sad state of affairs when it comes to what the government is willing to do. But it is what it is right now and what we're dealing with. And that is one of the challenges that face patients. In this particular situation, Lucas, having come out of hospital, was able to get the drug. And Ontario actually changed their policy as a result of Lucas. And we call it the Lucas rule. But now patients who are submitted into hospital and are prescribed a drug in hospital to save their lives may get access as the patient leaves the hospital. So I want to turn our attention to a Maclean's article in the Case for a National Drug Plan. This is actually another PNH patient, Garrett Shakespeare, who actually went to the then new Premier of British Columbia and at Christy Clark and asked and pleaded with her for help with his case. And again, what we saw is that this small group of patients across the country was making a major difference. The politicians knew them by name. They knew their faces. It wasn't so easy to just slide them under the carpet or ignore them. And thankfully, the provinces agreed to fund Solaris and PNH. And this is after about a 2.5-year battle for these patients, which is far too long. Some patients were lost along the way, but they did agree finally to fund this drug. And it really speaks to the importance and the difference that a patient can make, that one patient can make in not only their own lives, but in the lives of others suffering from the disease. And lastly, I'd like to share with you a picture of Lucas. And this is 6 months after being in the ICU and having very little hope. This is a picture of Lucas with his high school sweetheart and the day he was married. I remember getting a call from then Barry Katzoff, celebrating and talking about how special it was for Lucas to get his life back. And when you talk about the work we do in the pharmaceutical industry, this is why we do what we do on a day-to-day basis, and this is why we strive to make a difference in patients' lives. But the real heroes here are the patients and the ones who stand up for their rights, because governments cannot deny a patient who is very deserving of that chance for life and for living. And Lucas is now starting his life thanks to some heroic efforts from him and other patients. So thank you, and now I'd like to introduce Robin Hunter, who is the VP of Critical Care at Leo Pharma, and Robin will be much funnier than I am. Thank you, Robin.